everybody, welcome back to Soda City Living. Today we are out at the new Prisma Urgent Care here in Red Bank. I'm joined with Andrew Todd, one of the clinician leaders here. Thanks for joining me today.
Absolutely, thanks for having us.
All right, so you guys just opened recently. What have you been seeing? I know cold and flu season is really kicking off. I know I'm starting to see and hear it at work and everyone's talking about it. What have you guys been seeing for cold and flu season this year?
We have, absolutely. This location's been open just over 4 weeks now, and we've been seeing a great influx of patients all from the community seeking all kinds of care.
Yeah.
But obviously, as you said, flu season coming up, that's the main thing. The sniffles, the colds, the sore throats, of all the sorts. Urgent Care is prepped to take care of all of those different things. And so, we've been really stressing the community to be proactive in their care.
Yeah.
That's part of our convenient model of the hours that we're open, as well as, the way that we do treatment. So, before you ever come and see us, we promote, our elderly and all of our family team members being seen to get their vaccines, to stay ahead of their care, to take care of themselves.
Be proactive.
Be proactive in everything that they do. And then if they need to come see us, we have all of the things in our centers to take care of them, whether that's a test, whether that's an x-ray, or whether that's just a medical evaluation and a prescription. And we want to get that for those team members.
Yeah. Is there anything that we can be doing at home or things we can be doing to kind of prepare ourselves for this sick season, things we can be doing to make sure that maybe we can avoid the illness this season?
Absolutely. You've heard it a million times, but washing your hands really is the best way whenever you touch something or other people is to prevent the spread of care. If you're sick, we encourage you to stay away from big populations, or if you're going to go out, to be mindful, covering your mouth when you're coughing, wearing a mask, and all of the sorts.
Yeah.
And then just for your general well-being, all of those things, taking your vitamins, drinking plenty of water, staying in a healthy state of mind.
Yeah, just taking care of yourself and your body. It's the best thing you can do.
Yeah.
And you guys have lots of locations across the Midlands, lots of convenient ways that you guys can come and visit urgent cares. Why would you tell someone to visit an urgent care as opposed to immediately going straight to like an ER or something like that?
Yeah, absolutely. We're now to over a dozen urgent cares here in the Midlands area, including our virtual option. And so, that's kind of what I would say, that our commitment is to, convenience and access to care. We want to be as close as possible to all of our team members. When you're sick, you don't necessarily have all of the time to go very far somewhere or to spend a lot of time somewhere. And so we want to be as in many places as possible and have as much access to care as possible. So all of our centers are open extended hours every day of the week. So 7 days of the week, 8 a.m. to 8 p.m. And across all of the Midlands. And so I would say, if it fits the time frame and the area that you need to be seen, absolutely come and see us. We want to be there after hours from school or late night at work when parents are working to keep you out of the hospital.
Right.
But I would say, picking between urgent care and emergency care, obviously if you're debating whether you need to call an ambulance for 911, it's certainly better to go to the hospital.
Right.
And then if you're having any severe things, so stuff that you don't feel like you can handle controlling within our center or outside, so extreme shortness of breath, you're having the chest pain, your extreme headaches or dizziness, stuff that over-the-counter medicine hasn't necessarily helped with already.
Yeah.
And then of course all of our clinicians are very professional and trained in emergency medicine and family medicine, and so if you do come to one of our centers, we're going to give you that prompt care and guide you best to the place of care that you need.
Right, and I think that can be a common misconception as well, is that urgent cares can't connect you with providers that you need to connect with.
Absolutely. Our partnership with Prisma is very much well blended, all the way down to the same computer system that we use.
Awesome.
So even if you go a month later to a different Prisma doctor, all of our records and all of our communication is going to be saved in there. If we do need to refer you to a specialist, we can quickly get all test results, we can get all of our information, and we'll oftentimes even have their phone number, and we're calling them and giving them that prompt information.
Amazing.
And so the connection between us and the larger system of Prisma and all throughout the Midlands is crucial to keeping your health care in line.
Yeah, and the convenience is a key factor for lots of our families. If people are interested in coming out and finding, a Prisma Urgent Care near them, what's the best way for them to do that?
Yeah, absolutely. Just go onto our website, prismahealthurgentcare.org. It will have a list of all of our locations. It has a list of all their phone numbers, and it has direct booking links for in-person as well as our virtual site. And that's really going to give you the most up-to-date information on where we are, how to get our care, and as quick as you can get our care.
Awesome. Well, thank you so much for chatting with us about this. Very important this time of year.
Absolutely. We appreciate you guys being here.
Sure. Thank you.